it just sounded like it was exactly what I was feeling and thinking, and the people in it were very like-minded, and I just felt right at home.
Listening to Catherine with her vision of returning the responsibility of healthcare to the people was just amazing.
We looked at these mission statements. I was ticking them, tick, tick, tick. I thought, well, hang on a minute, that's exactly what was in my head. So that's really why I got on board. I was so excited. I thought, wow, this is a way to go forward.
It was almost instinct. It was like, yes, that's like the missing link that we need.
For me, it was a no-brainer. Bring community together, empower them, and help us to look after our own health.
It was a vision that I've had, for many years. We are wanting to bring community together, wanting to bring holistic health into the forefront.
PHA was an opportunity for us to educate people so that they could look after their own health.
I see the PHA growing, not just stay in health. We've already got groups that are springing up that are concerned about education and our youth.
It's with the size of Australia, there are lots of other groups doing similar things. And so this is where we're starting to look at, how do we collaborate with those people that align, that have the same values, the same vision? How do we collaborate so that we're not reinventing the wheel?
Getting older people with skills to help share those skills with the younger people, and we want to proliferate. We want to go round to all the different neighborhoods so people can have somewhere they can walk to. And it needs to be some place that is just open and welcoming. People can just walk in. We're trying to help people to help themselves.
I, for one, am a huge believer in community. There's so many studies, aren't there, that shows time and time again that when people are isolated, they start to develop health issues. And so, we want people to be able to say, let's just go up to the health hub today, let's have a coffee there. Hopefully we can have a huge smorgasbord of treatments available for different levels, and people can really say, this is ours.
What we have managed to do is create a really wonderful network of therapists who are in different modalities and really want to get on board with us.
It's about bringing people together and helping them to feel valued, to feel empowered and supported.
I feel like I've got backup. I feel like these guys have got my back.
During the floods, there were a lot of people traumatised. We had these major storms. They weren't normal storms. Hawke's Bay was severely flooded. So was West Auckland. People were cut off. There was no services getting to many of them. They weren't even receiving information of what was going on. So PHA, I was having mixed reports about what was happening, didn't trust what I was hearing. So I just got in the car and went. But within a day of me saying I was going to go, all of the community rallied. People were giving me money for petrol. They were giving me supplies to take, food. And when we got there, we were able to speak to groups on the ground, connect communities, literally go around community and say, what do you need? What's available? What's missing? People would just burst into tears because they couldn't believe someone was actually turning up, that their voices were being heard, because the government weren't listening, the councils weren't listening, there was no help, there was no army.
We're learning as practitioners, and then that allows us to then be able to provide such a beautiful service because we're all being able to understand from all of these different perspectives. I see that as a really key part of what PHA stands for.
We've already got 3 primary physicians in place, 3 mental health coaches, we've got 3 doulas, so that's where the pre and post-pregnancy support comes in. Lots of fantastic therapists. We've got a PA, we've got yoga specialists, a phlebotomist, potential clinic managers. We're all ready.
The challenges are people still think we're a bit weird. But, it's okay because I have friends in that neighborhood who are very supportive.
See, New Zealand is a really interesting country to be in because there's such a mix of people from around the world that end up in New Zealand. So the challenges have been to encourage people to come together and talk through their differences and to realise that these PHA hubs are for everyone in the community. It's about talking with everyone that comes together and making it work for everybody. And that's the beauty of it. And that is, for me, the way forward. As a community and as a people, we need to be talking together and learning to hear what others have to say and not just ruling somebody out because they're in the minority, but actually bringing everyone together on the same page.
Bringing all of these different ways and perspectives of health together. There's so much wisdom that is held there. There's a lot of incredible expertise that are already held in the system. But what we want to be able to see is this is not the only way that we can work together to be able to support somebody in their health journey, in their own healing journey that pulls from all of these different perspectives, whatever they need, so that people can find their own way through that.
So 4 weeks in a row, we hired out a community hall in the local village, and various therapists were there to welcome people who perhaps needed some more guidance. And we got the word out. People actually saw our advertising, which was great. Unfortunately, because of funding issues, we then had to stop after the 4 weeks, just as we were getting into it. So we're looking at getting extra funding so that we can start that again.
We basically want everybody that's interested to come along.
Health hubs definitely just need more people to come along and help do stuff.
So definitely more funds and just more support to help us to support individual hubs. That's what we need.
We obviously need long-term funding really to find a physical health hub, whether that's a mobile one or a fixed one. It'd be great to have both and to be able to go and do like mobile drop-in health hub sessions, but also funding just for things like having our business address, because we don't have a physical health hub. We'd have to hire a business address and we have to pay that on a monthly basis.
I know it's difficult and it can be scary. It took me a long time to set up a community wellbeing afternoon, and I haven't done it on my own. I've got a great team behind me as well. But just taking that first step forward, get on the phone, just have a chat with me or one of the other ladies, and just take that first step.